What is poverty? Poverty is one of the most significant disparities in women's health. Research show that when there are more women that live in poverty than men, which is due to a variety of reasons. To understand how poverty affects women, it's essential to first learn the definition of poverty. Most people would describe this as being poor and having no money. However, this is a common misconception and not a definition that is uniformly adopted around the world. The United Nations define poverty as a state or condition where someone lacks the basic needs to sustain life, such as access to food, shelter, or even clothing. As we're becoming more economically driven and developed globally, poverty can also include limited access to economic and vocational opportunities such as education and employment. Every country measures poverty differently. In the US, poverty is measured by a family's income, which can include Social Security benefits, disability benefits, earned income, public assistance, veterans payments, unemployment compensation, alimony, child support, etc. It also varies by family size and age, and it is compared to the minimum amount of income needed to cover basic needs like food and shelter. Those who fall under this threshold are considered poor. The United States Census Bureau is the government agency in the United States responsible for measuring poverty. India has a slightly different definition of poverty, where it's a condition where an individual or household lacks the financial resources to afford the minimum standard of living, um, which ironically, they don't use income to determine their poverty threshold. They actually use consumption expenditure. So basically, the amount of money that it would take to afford the minimum standard of living. And this is because income varies so much in India and it's very difficult to track considering all the different circumstances. The Planning Commission was the government agency responsible for measuring poverty, but as of 2015, the National Institution of Transform India measures poverty through data collected by the National Sample Survey Office. The last time they had released any information was 2011. Despite India and United States being opposite economically, we actually see very similar percentages of the amount of women living in poverty. Out of all the people living in poverty in India, 61% of those people are women, which we could also see a striking similarity in the United States. Out of all the people living in poverty in the United States, 56% of those are women. Despite the apparent differences in culture, sexist attitudes and patriarchal hierarchies continue to stereotype Indian and American women and force them into roles that limit their ability to exercise autonomy and individualism. By pressuring women to remain caregivers and requiring them to tend to household chores, women cannot acquire the education and jobs necessary to propel them out of poverty. It seems, however, that India is more committed to culture and upholding certain traditions than the United States. Perhaps this is because of how diversified America is becoming. As different cultures and practices continue to mesh together, women in America are beginning to find their way and voice more easily. Factors contributing to the poverty of women. Gender bias is the primary factor responsible for the allocation of resources, and it can begin as early as infancy. Women are often deprived of what they need to be productive members of society. Sexist attitudes and patriarchal societies tend to have the most significant impact on poverty for women. Gender roles have designated women as dependent individuals bound by the responsibilities of being a wife, a mother, and a daughter. Another primary factor is the gender gaps that exist in the workplace. Men are often labeled as breadwinners, whereas women are viewed as unpaid caregivers, further contributing to financial entrapment. Unequal division of labor leads to less education, less employment opportunities, which discourage development for women, leading to more male dominated job sectors, also increasing gaps in the workplace and for wages. Working women are also paid significantly lower than men and are often required to leave work, rearrange schedules, or take unpaid time off to fulfill their caregiver obligations. Violence against women is another factor contributing to the poverty of women. Men like to exercise control and dominion over women, belittling their self esteem and opportunities to become affluent and productive members of society. Lack of political representation and lack of legal protection also make it different for women to become aware, nevertheless, enforce their rights and privileges for adequate health care, equal pay, and equal academic opportunities. These factors affect both women in the United States and India. One factor that does differ between American and Indian cultures that heavily impact women's poverty is the prevalence of arranged and early childhood marriages in India. Early childhood marriages contribute to an increase in adolescent birth rates that prohibit women from attending school and acquiring an education that can contribute to their participation in economic development and overall society. The overall impact of poverty on women's health has been extensively documented over time. Before we discuss how poverty affects women's health, I think it's essential to recognize that women are uniquely different than men biologically and physiologically, which often requires more health care attention for women than men. And this is simply because of our complex systems. Like, for example, in addition to annual physicals, women must also see their gynecologist yearly for routine examinations, screenings, breast cancer screenings, things of that nature. Those who are engaged in sexual activity must also make more frequent visits to the doctors to acquire methods of contraception. This could be very difficult for women in poverty who lack insurance or lack the additional funds to cover such services, which puts them at risk for unwanted pregnancies, unsafe abortions, also just trickling a bunch of different effects. Those with unwanted pregnancies are often young or often not in a position to take care of a child, which will further push them into poverty. It's also important to note that the methods of contraceptions that exist in the United States are scarcely available in India, which limits their right to decide when to get pregnant, how to get pregnant, how many children they'll have, etc. Despite laws against early marriage, a considerable number of females get married and start childbearing during their adolescent years because of the low prevalence of contraceptive methods and the high unmet need for family planning, which is directly linked to poverty. Typically, women in poverty or females in poverty are more likely to marry early because in India it is believed that women cost more to raise, therefore they tend to arrange them in early marriage to get them out the house and kind of relieve the family of the financial responsibility. This impacts their health because females are not ready to start childbearing until they're at least 18 years old, and I'm talking in terms of just physically ready, not mentally or financially or emotionally ready, but just physically, which puts them at an increased risk of preterm labor, systemic infections, endometriosis, neonatal conditions, even death. So this is definitely a big issue, even though early marriage is something that's occurring in India. We still see a lot of adolescent pregnancies occurring within the United States, and this is really directly linked to the lack of education, which also is linked to poverty. As we know, being in the United States, if you don't have money, you can't go to school, you don't have insurance, um, you don't have money to get services. I mean, Planned Parenthood is a wonderful organization that is trying to reach those communities, those lower socioeconomic individuals that are unable to get these kinds of services. However, we have seen through just the last like 5 years or so how government officials and federal and state officials try to really govern these areas and limit um, Planned Parenthood and organizations alike, um, which is really unfortunate because most of the people making these kinds of decisions for women are men. So that just kind of shows the shift and the disproportion in power. Although the United States have more resources available for women, reproductive autonomy and access definitely remain a significant issue for women living in poverty. Research has also shown that people in lower social economic groups experience poorer health and risk a shorter life expectancy than wealthier people. Lower socioeconomic groups are also at increased risk of depression, anxiety, and low self esteem. This discourages women from attempting to create a better life, taking a chance, even knowing how and where to go for these resources. So they're less likely to attend school or even seek better employment. Women in poverty also lack adequate transportation or have difficulty finding childcare, which makes it difficult for them themselves to seek care, undergo treatment, get these routine exams, or the necessary screenings to maintain optimal health for themselves. In the United States, insurance coverage is directly linked to employment. Therefore, women who have part-time jobs or have no work have an increased risk of lacking insurance, which leads to large out-of-pocket co-payments for healthcare services. Because healthcare in the United States is predominantly run by private sectors, this raises the cost of care for profitability. In 2017, 1 in 4 women reported that they delayed or went without care due to the costs of the services, which is really unfortunate. The Affordable Care Act did a really great job at including way more people than it once did. So women in the lower socioeconomic group are able to get insurance. However, there is a very limited network, and sometimes doctors within those networks are out of their reach, meaning like if they don't have the transportation to get to a certain place, it also makes it difficult to receive that care. In India, healthcare is universal, but the system is underfunded. So they experience a lot of shortages of staff, supplies, making healthcare services very hard to obtain. Typically, Indian citizens would turn to private sectors for care. However, this kind of leaves out the lower income individuals. So it's very similar to the United States where, you can get universal health care or you can get Medicaid insurance, but how much support are you really getting? How much more access to these healthcare services are you really getting, especially when government funded healthcare is usually less quality than private. In addition to the factors that I discussed in the previous slide, there are additional components that impact women's health. About one third of the households in the United States are led by single mothers. A majority of these women fall below the poverty line. Therefore, a lack of familiar and public support, like public assistance, getting health care, additional money for co-payments, child care assistance, pushes them further into poverty and contributes to this vicious cycle that not only impacts them economically, but their health as well. Most women in poverty end up having unhealthier lifestyles, such as food choices, lack of time for cooking, or limited money for food may cause them to resort in indulging in like fast food because it's easier and cheaper. Women in poverty are also more likely to smoke, drink alcohol, do drugs. Such behaviors are known to harm health. Not also considering the money allotted to such behaviors reduces the money available for healthcare services, also further contributing to poverty. Poverty's impact on mental health is a huge factor in women's health. Poverty increases the risk of anxiety, depression, and even suicide rates. There is a lot of research that links poor mental health with overall physical health and well-being. So this is a very important factor to consider when considering how poverty impacts women's health. Ethical considerations. There are several concepts to consider regarding ethics. Urbanization can be seen as a double-edged sword in women's health. It's associated with more significant opportunities that promote independence. It provides economic, social, and political advantages that allow access to better services. However, it's only beneficial when the laws and policies are enforced by government officials to ensure that women are not excluded from this concept. Most inequalities in women's health are rooted in discrimination brought on by culture and traditions. In India, women are traditionally known as caregivers and viewed as inferior beings. These ideologies deny them access to education and employment opportunities because the concern for family welfare takes precedence over their individual health, delaying treatment, or even not receiving care. This is a similar concept that we see in the United States with older generations. They definitely, like especially with the Hispanic community, women tend to take care of the family and deny themselves of their rights to health care, and not intentionally, but just because they are bounded by the responsibilities of being a mother and wife. However, for single women who live in poverty, we also see this kind of trend, but not necessarily because family welfare is so important, but because they have limited access, whether it's due to poverty or lack of support that allows them to take the time away from their job or to find the childcare, to get treatment, or any kind of healthcare services that they're in need of. Discrimination in the workplace is a common theme across India and the United States. Women are often subjected to sexual harassment, lower positions, and unequal wages. Gendercide is a concept in India that refers to the pre-screening for girls to determine whether or not to proceed with an abortion. Women who bear daughters before sons are considered inadequate and usually shamed in their culture. Gendercide is something that still continues to happen, even though there are laws that are that have been placed to prevent these kind of horrific acts. There are actually women and couples that will travel to other countries or even the United States to get these pre-screenings. A reason of why this is also related to poverty is because in India, society believes that it costs more money to raise a woman than it does for a man, because a man can go out and work and a woman has to stay in the house, take care of the house, so it's another mouth to feed. So this kind of situation really impacts women in poverty or the lower socioeconomic classes in India. Violence against women is multifaceted and reflects the unequal power the unequal power between men and women. Enforced marriage or marriage at a very young age is due to lack of information, lack of choice about pregnancy or fertility control, and shows up in forms of coercion that results from unequal power and aggravate the risk of violence against women. Exclusion in the medical field is another ethical issue in women's health. Lack of funds and attention to clinical research using women in clinical trials to understand better treatments and medications are overall harmful for women. There's a significant amount of medication and healthcare services that have been approved that actually harm women, but there's very limited research that indicate that, because women are rarely used in clinical trials. This has been changing over the course of the last few decades, but there is definitely a prevalent issue that is continuing because of the lack of women who are advocating for these kinds of things. Poverty makes it really difficult for women to retain the knowledge and advocate for their rights. So education is really key in trying to make these shifts and changes in society, promoting gender equality. Systems of patriarchy have subjected women to social, cultural, and religious subordination for centuries. Despite urbanization, fighting for women's rights is an uphill battle. The number of women living in poverty compared to men directly reflects the lack of value placed on women, which is leading to several human rights violations. This vicious cycle does not only harm the individual, but creates generational poverty and continues to burden society. Creating laws is simply just not enough to relinquish poverty. Regulations and policies must be enforced, even at the community level, by providing women with the education that they need to become their own self-advocates. In addition, there needs to be more men that are becoming sensitized to their counterparts and really advocating for women. Simply just because of the significant value that they contribute, not only economically, but just as a human being, like really changing perspectives that we are all people despite our genders. Reducing poverty to improve women's health is a collective work and requires the transformation of legal, cultural, traditional, political frameworks that have existed for decades, even centuries. UN Women is an entity of the United Nations dedicated to gender equality and the empowerment of women. They work every day with organizations around the world to improve and advocate for women's rights, assuring access to education, healthcare, and employment for women across the globe. It's important for us as men and women to stand up for those who are unable to stand up for themselves. and to put an end to gender discrimination so that we could all live in a world that's safe, equal, and thriving with opportunities and resources for everyone to participate and enjoy. Thank you so much.